A warm welcome from the Department of Oral Medicine and Radiology, Meenakshi Ammal Dental College and Hospital, Chennai. Today, we shall be discussing about a few clinical descriptive terminologies that are used for describing oral mucosal lesions. Objective: at the end of this presentation, you will be able to identify and describe oral mucosal lesions so that all oral health professionals can communicate efficiently in one language. Contents: the following presentation will be including these terminologies: lesion, which is primary as well as secondary; macule, papule, plaque, nodule, vesicle, bulle, erosion, crustacean, ulcer, pustule, fissure, cyst, hemorrhage, which is again classified as petechiae, purpura and ecchymosis, verrucous and papillomatous. Clinical examination is the most important step in a diagnostic sequence. A clinician should be familiar with the descriptive terms that are used to describe any lesion. By doing so, he or she can efficiently describe a lesion, which would in turn help in formulating a diagnosis. A lesion is a visible change in the normal anatomical structure caused by a pathological process. A primary lesion is the first pathological change that is manifested clinically, and a secondary lesion is an altered primary lesion. To begin with, a macule. These are lesions that are flush with adjacent mucosa and that are noticeable because of their difference in color from the normal skin or mucosa. They can be red due to increased vascularity or inflammation, or they can be pigmented when there are presence of melanin, hemosiderin and foreign materials, including the breakdown products of medications. Example, an oral melanotic macule. Papule. These are lesions raised above the skin or mucosal surface and are smaller than 1 cm in diameter. They may be slightly domed or flat-topped, and example is an yellow-white papule of pseudomembranous candidiasis. Plaque. These are raised lesions that are greater than 1 cm in diameter. Nodule. These lesions are present within the dermis or mucosa. The lesions may also protrude above the skin or mucosa, forming a characteristic dome-shaped structure. Example, an irritational fibroma. Vesicle. These are small blisters containing clear fluid that are less than 1 cm in diameter. Example, herpes simplex. Bulle. These are elevated blisters containing clear fluid that are greater than 1 cm in diameter. Example, pemphigus. Erosion. These are red lesions caused by the rupture of vesicles or bullae or trauma and are generally moist on the skin. They may also result from thinning or atrophy of the epithelium in inflammatory diseases such as lichen planus. Crustaceans. These are dried blood, serum or other exudates covering an ulcerated area. This area is called as pseudomembranous if it is moist. Example, erythema multiforme. An ulcer. An ulcer is a well circumscribed, sometimes depressed lesion with an epithelial defect that is covered by a fibrin clot resulting in an yellow-white appearance. Example, an aphthous ulcer. Pustule. These are blisters containing purulent material and appear yellow in color. Fissure. Fissure is a linear slit in the epithelium that usually occurs in the lips and perioral tissues. It may harbor inflammation and ulcerations if it is infected. A cyst. A cyst is the pathological cavity lined by epithelium having fluid, semi-fluid or gaseous content that are not created by the accumulation of pus. Their size may range from few millimeters to few centimeters. Next, a hemorrhage. A hemorrhage can be classified into three types: a petechiae, a purpura or an ecchymosis. These are reddish to purple discolorations caused by blood from vessels leaking into the connective tissue. These lesions do not blanch when pressure is applied. In case if the lesions are less than 0.3 cm, it is said to be a petechiae. If the size ranges from 0.4 to 0.9 cm in diameter, it is said to be a purpura, and in case if it is greater than 1 cm in diameter, it is classified as an ecchymosis. Verrucous. Verrucous projections are wart-like projections on the surface of a lesion. Example, a verrucous carcinoma. Papillomatous. Papillomatous refers to cauliflower-like projections on the surface of a lesion, and they are often pedunculated. Example, squamous papilloma or verruca vulgaris. These are my references. Thank you one and all for your patient listening.